Getting wet. So we're here in the rain. We're all getting wet. My next speaker is Kathy Matusiak from Compassionate Community Care. And so Kathy, can you speak for like 5? Is it good? Very good. And now Compassionate Community Care is an organization that provides, Tamara's here if you want to say hi to her. But obviously we want you listening if you can. Compassionate Community Care is an organization that provides training and help to people visiting, etc. So, Kathy.
Thank you, Alex. And Ms. Jensen, thank you for being here for everyone. Can you hear me all right?
Yes.
Thank you. Thank you. I'm here on behalf of our charity, Compassionate Community Care, which specializes in assisting Canadians across our good nation with issues related to end-of-life, crisis, advocacy-related issues, and any questions or concerns related to euthanasia and MAID, or medical assistance in dying. We provide a free 24-hour helpline, 7 days a week, on which we receive calls daily on cases which you've heard today described to you, and testimonies from people who are either considering euthanasia or are booked to die by MAID. Canadians, I can attest, feel the pressure to choose MAID because of lack of hope, despair, loneliness, and their fear of suffering. These are normal considerations and situations that people face when pressed with end of life or a health challenge. We've had cases of people not being offered treatment for a toe infection and instead being referred and then approved died by MAID. I've heard first-hand witnessed cases of a grandparent just recently, a grandmother diagnosed with sepsis on Tuesday, booked to die by Friday. Thankfully, because of our involvement and consultations with a direct member of her family, and due to the strong relationships around her, especially that of her granddaughter, simply 1 or 2 people sharing how much she means to them changed her mind. The same grandmother ended up dying naturally the day after she was booked for MAID on the Saturday afternoon. We later found out that a family tied to this grandmother had been present at a MAID death of someone in the family not too long before this situation arose. She said and recalls that it is a barbaric practice that should have never been allowed. People need care and compassion, not a lethal injection. Canadians need better health care, not death management. Knowing that we have surpassed over 100,000 cases of this in our medical system, dying in Canada is a tragedy, to say the least. And now, sitting on our heels is the entry of mental health illness as a single condition for eligibility for medical assistance in dying, slated for March 2027. In less than a year from today, the floodgates will open, and not only will there be a tidal wave of mental health cases eligible solely for MAID, but this will invoke a parallel catastrophe in the mental health sector wherein therapists, mental health counselors, psychotherapists, and the like will be forced into a situation where they will have to effectively refer or approve euthanasia of their patients. We're seeing it already. Cases of MAID for mental health have already started and are running through the gaps of the system. Christopher Leon witnessed his father's MAID death be approved while being allowed to drink and be intoxicated. We see the case of Keanu, mentioned sadly today, again, as he died just before New Year's Eve. This past New Year's, Keanu traveled to get euthanized. He was a young 26-year-old man facing no terminal illness, only seasonal depression, and had blindness due to diabetes. His depression, which was relieved with the help of a caring, compassionate family, the community that rallied around him, he instead chose to travel to BC and be killed by one of Canada's infamous death doctors. The eligibility criteria has been completely engulfed by those who are stuck between a hard place and an open door to death. Canada needs a complete overhaul of its medical assistance and dying regime. And it's only a review, that is not only a review, but a halt of the system. The system has failed Canadians across our nation. We get flooded with calls from individuals who are scared to die in a hospital and are looking for safeguards because they don't want to be approached by MAID. Another call came in last week from a lady in Western Canada who, when she went to a local area hospital, was offered MAID 3 times for back pain. She walked out without any treatment, was threatened, and no support for her back. But she was told she can always come back and get euthanized. This is atrocious. I worry for the future of Canada when our children are no longer ours since they meet the eligibility criteria. As young Keanu's mom, Margaret, told me at his funeral, your children are not your own once they reach the age of consent. They belong to the government. We have also recently started, in the last year and a half, a free seniors calling program, which is spreading like wildfire across Canada. We are offering free calls to seniors, anyone 55 and over, to receive safe, reliable, and consistent calls from a vetted, safe, trained volunteer caller. We have offered this service, and it is free of charge. We have ongoing trainings to help you build communities of care that provide compassionate visiting support for free in your own community. Please contact us if you'd like to have a training in your neighborhood, or join us this week on Wednesday and Thursday night, where Alex and I will share you with our breadth of knowledge and expertise. We need better than euthanasia and medical assistance in dying. We need hope. Please be part of that solution and support real care. We need a culture that cares. Being there truly means being present. When people are there, they make a difference. Thank you.
You're here. Thank you. You're here.